Hello everybody, my name is Evelyn Soriano, and on this video we're going to talk about the Medicare changes that were just released for 2022. These changes take place every year, but please be aware that these changes are not the changes that take place within your health plan. Either if you have an HMO or PPO, an Advantage plan or a supplement plan, you should be receiving a booklet, or you should have already received a booklet from your health plan stating these changes that will take place within your health plan for next year. These changes are coming directly from original Medicare, so we're going to go over those changes and how you will be affected by them. At the end of this presentation, you will find my contact information in case you still have any questions or concerns. Please feel free to contact me and I will answer any questions for you. So let's get started. Original Medicare includes Part A and Part B. First, we're going to go over Medicare Part A. In Medicare Part A, includes inpatient hospitalization, home health care, skilled nursing, hospice care. The monthly premium is typically zero, and it will depend also on whether you accumulated the 40 credits that are required for you to get this at zero monthly premium. If you are paying a monthly premium for Part A, that means that you didn't have the 40 credits or that you have a higher income, or both. If that is the case, you might want to check with Social Security or Medicare directly to see what would be your monthly premium for next year. But for most of you who have a zero monthly premium for Part A, it will remain the same. There will be no change there. Okay, so these are the Part A hospital insurance and the deductibles and coinsurance that you would have to pay if you didn't have anything covering for that 20% that Medicare doesn't cover. These deductibles and coinsurances are usually lower for those who have an Advantage plan or a supplement plan. If you have original Medicare and you are hospitalized on day one, in 2021, you would have to pay $1,484. This amount just went up for 2022. And in 2022, if you are hospitalized from 1 to 60 days, you would have a deductible of $1,556 per benefit period that you would have to pay. Basically, on day one, you would have to pay this, and you can pay this up to 5 times in 1 year if you are with original Medicare. If you are also with original Medicare, you would have a coinsurance that you would need to pay if you go to the hospital and you stay more than 61 days to 90. In 2021, the coinsurance for days 61 to 90 was $371. This is going up for 2022 to $389 per day. This amount can be up to $11,281 in 1 year. There is no limit there. Original Medicare also has a lifetime reserve coinsurance. If you are hospitalized from 91 days to 150, this lifetime reserve coinsurance in 2021 was $742 per day. This amount will be going up in 2022 to $778 per day. In 1 year, this amount can go up to $45,902 in the entire year. So please be aware that there is no limit with original Medicare. If you are with original Medicare and you are considering, or you are wanting to know how to cover this expenses, these deductibles and coinsurances with Part A, please give me a call and we can give you a plan that will cover most of these deductibles and coinsurances so that you don't have to pay up to $45,000 in 1 year. So most of these plans do have a limit on what will you have to pay. You also have a skilled nursing facility coinsurance that you would have to pay days 21 to 100. The year of 2021, the coinsurance was $185. This is also going up for 2022 to $194.50 per day, and in 1 year it can be up to $15,326 per the year. Okay, so let's move forward. Medicare Part B. Medicare Part B covers you for outpatient services, and it includes office visits, surgeons, ambulance, ER, urgent care, and radiology and labs. The standard monthly premium for 2021 for Part B is $148.50. Medicare just announced that this amount will increase to $170.10. This is the part that most of you will be affected by because most of you have a monthly premium for Part B. If your premium is higher than $148 in 2021, it might be due to your higher income or that you didn't accumulate all the credits that you were supposed to accumulate. So let's look at those amounts. Okay. If you're a single person and you file your income taxes, if your income is less than or equal to $91,000 a year, then your monthly premium will be $170.10. If you are married, if you're filing as married, filing jointly, and your jointly income is $182,000 or less, you will also pay the $170. There is no increase there. However, if you're a single person and your income is greater than $91,000 but less than $114,000, your Part B monthly premium will not be only $170. It will be $238.10. The same thing if you are married and your income is within $182,000 up to $228,000. If you're single and your income is between $114,000 but less than $142,000, or if you're married and your income is $228,000 but less than $284,000, then your Part B premium would be $340, and so on and so forth. In this video, I will include a link for those of you who are making more than this amounts so that you can see how much your Part B monthly premium will be according to your income. Part B also has an annual deductible that you would have to pay if you are with original Medicare. The amount of the deductible for 2021 is $203. This is going to be going up to $233 for 2022, an increase of about $30. Part D will also experience some changes next year, starting with the deductible, which in 2021 was $435. That's going to go up to $480. That is if you have a deductible. No plan can charge you a higher deductible than this amount, the $480. So you might be paying $480 or less if you do have a deductible. But most plans nowadays who are HMO, PPOs, Advantage plans, don't have a deductible. So you might not even see this change. Once you have paid the deductible, you go into the initial coverage, which is stage 2. During this stage 2, you will pay 25% for all prescription drugs, and the plan will pay 75%. Once this total out-of-pocket for you and the plan totals $4,130, then you move up to the next stage, which is the coverage gap, also known as the donut hole. In 2021, it was $4,130 for you to go from the initial coverage into the donut hole. Next year, this amount is going to increase to $4,430. So you will have to reach a little bit higher before you're able to get into the coverage gap or the donut hole. In this stage here, which is stage 3, you will pay 25% of generic and brand name drugs. The plan will pay 75% of generic drugs and 5% for brand name drugs. Here, they also include the manufacturer discount 70% for brand name drugs. Once this amount has total and out-of-pocket costs of $6,550, that was in 2021. In 2022, this amount is going up to $7,050. Once you have reached this amount, which is also referred as the TROOP or true out-of-pocket cost, then you are going to be going from the stage 3 coverage gap donut hole into the catastrophic phase, where you only pay 5%, or basically the greater of 5% coinsurance, or $3.70 towards generics in 2021. This is going up for 2022 to $3.95. For any other drugs in 2021, you were paying $9.20. This is going up for 2022 to $9.85 copay for any other drugs. Part D coverage starts over each year on January 1st. So basically on January 1st, everything will go down to zero again, and you will start accumulating the amounts towards the deductible, then moving up on each of these stages. This will affect mostly those who are in original Medicare. Those who have an Advantage plan or a supplement plan will see the change for Part B monthly premium, but other than that, your plan will determine your co-payments. So take a look at that booklet that you should be receiving pretty soon for the changes within your plan for 2022. And that's all. I hope that this information was helpful. If you have any questions about the information that was presented here, please give me a call to my office, which is 1-800-913-9498, or via my website, which is evelynsoriano.com. Thank you and hope to hear from you soon. Bye-bye.